Hi everyone, I'm Lana Zach. A growing number of children are being diagnosed with a mysterious disease known as pediatric multisystem inflammatory syndrome. The illness could possibly be linked to COVID-19. Initially, health experts believed that children were being spared the worst of the coronavirus. Those that did contract the disease usually had only mild symptoms. But now several states are investigating this mysterious illness in children, including New York, where at least 3 pediatric patients have died. Dr. Luiza Petre joins me now. She's a cardiologist and a professor of cardiology at Mount Sinai's School of Medicine. Dr. Petre, thank you so much for being with us. Please tell us what exactly is the link between this illness and COVID-19 in children.
Indeed, Lana, we're seeing more and more children presenting with these unusual symptoms. We're seeing a surge of cases that are similar to Kawasaki disease and a little bit overlapping with something that's called toxic shock syndrome. That's a disease when someone would have a severe infection. So the syndrome you just mentioned, it's actually a new entity because it has overlapping features between these 2 diseases. So what we're seeing common with Kawasaki disease, that children present with this strong inflammatory syndrome. And in a way, this is a common denominator with COVID-19. We know a lot of people develop this strong inflammation. But what's unusual, we're seeing these children presenting with swollen glands, fever that doesn't go down. They come with red eyes, abdominal symptoms. And Kawasaki disease is an inflammation of small arteries affecting the heart, the brain. But also these people are usually sicker than Kawasaki. And what's mysterious about it, not all these children cases are positive for COVID. The majority of them are, and some of them even 4 to 6 weeks later.
So I want to unpack some of what you said. I think that for most people, Kawasaki's disease, this may be the first time that they're hearing that. What exactly is that disease? Is that something that is a pre-existing condition in some children that make them more likely to get this new illness that's possibly linked to COVID-19? Let's start right there. Can you tell us a little bit more about what is Kawasaki and how is this new illness different from that? And if a parent has a child that's had Kawasaki's disease before, does this put them at a greater risk?
Kawasaki is a disease predominantly for children. It's very rare to see this in adults, and it's manifested by a strong inflammatory response. So they have swollen glands in the neck, they have skin manifestations, red eyes, pain in the abdomen, pain in the chest, and a high fever. And if you take them to have some blood testing, the inflammatory markers are very elevated. The treatment is supportive. It requires anti-inflammatory medication like steroids, sometimes immunoglobulins. Unfortunately, in these cases we're seeing right now, they actually tend to be more severe than typical Kawasaki disease. That's what's concerning. And a lot of cases do require ICU, almost 80% of them. But also it's unusual that a lot of Caucasian children, 70% of them, and they are more predominant on the East Coast versus the West Coast. So we're trying to understand if there is a genetic predisposition to that.
So the top line then for parents, if your child is sick and is presenting with any of those inflammatory symptoms, that they need to seek out medical help right away.
Definitely. In this syndrome, early intervention is critical as children can decompensate very quickly, and they should seek medical attention immediately.
And do we know why this is now being investigated? Is this popping up more now? Is it because doctors are looking for it now? What more can you tell us about this? Because I know as a parent myself that one of the big reliefs was the idea that children have largely been spared the problems that so many other people have experienced with COVID. I think a lot of people have been more concerned about their own parents or grandparents rather than their children. But now it seems like we need to start being concerned about our children as well. Is that fair, or are we overreacting?
That's correct. However, the prevalence of this disease is still rare. Right now, we have probably 100 cases under investigation in New York area, almost only digit numbers on the West Coast and a few cases in Europe. But however, we don't understand the real magnitude. Are these delayed consequences, as a lot of children present weeks later after the infection? And as you said, we learn as we go, and there's a lot to understand about this disease.
And another thing that I had heard was that, and you were alluding to this as well, that some of the pediatric patients that are being tested that are coming in with this acute inflammatory syndrome, that they're testing negative for COVID, and yet doctors think that there may still be a link between the two. Can you explain that for us a little bit more?
That's something that we doctors don't have an explanation for. And if we talk about the frequency of Kawasaki disease, even the specialists in this disease, they say they've never seen more than 5 cases at once in one hospital. So that's something definitely suspicious about the timing between COVID and these cases, and the majority of them being positive for the virus. But again, we don't understand why some children test negative. It's either they didn't have immune response to develop antibodies. That remains very unclear why children initially had so little symptoms compared with adults, and all of a sudden we're seeing this hyperimmune response and hyperinflammation.
So again, we still are learning so much about this, but we thank you for putting this into perspective. And of course, if a child is sick, regardless of the specifics of those symptoms, consult with your healthcare experts, is what I'm hearing.
Absolutely. Pediatricians are on alert, and the American Academy of Pediatricians actually issued treatment guidelines and how to approach these children.
Dr. Petre, thank you for joining us.
Thank you.